Hey y'all, it's me, Dr. Smina Rahman, Gyno Girl. Welcome to another episode of Gyno Girl Presents Sex, Drugs, and Hormones. I am a sexual medicine and menopause specialist in Chicago. Been practicing exclusively sex med and menopause for the last 10 years and practicing OBGYN board certified for close to 20. Oh. I am on the board of the International Society for the Study of Women's Sexual Health, or ISWISH, and I'm a certified menopause doctor through the Menopause Society. So I'm very much into this. I love advocating for women. I love doing this. And I have a special podcast today with a special person named Lara Pack. And she is a vaginismus sister to me. She has struggled with sexual pain and vaginismus. So in her struggles and overcoming this, she has decided to create a model of vibrators that she feels like are more beneficial for patients to provide more pleasure during their treatments for pain. And so her vibrators are called Elixir Play. And so, she came up with this line of vibrators. And for those of us, just a reminder to you guys, vaginismus is a term used to describe involuntary pelvic floor contractions during tampon insertion, sex, or pap smears or exams. It is can be very distressing. It can be primary, where you're just anxious and sort of have a lot of sex negativity and therefore involuntary contract your pelvic floor. It can also be secondary to other things, but it's part of a sort of overlying arching theme of pelvic floor dysfunction and pelvic floor hypertonicity. And so it actually can preclude any kind of penetration. There are times when it's secondary to other things like vestibulodynia, which I've talked about. There are times where it's secondary to, an imperforate hymen. There's times it's secondary to other issues in the pelvic floor like vulvar dermatoses. And so studies have actually shown that, vibrators can be beneficial for women with pelvic floor dysfunction by improving muscle strength, can help strengthen the muscles that then reduce the chance of urinary incontinence, can enhance sexual pleasure, and alleviate symptoms like vulvodynia, vestibulodynia, and pelvic floor dysfunction by increasing blood flow to the area and promoting more relaxation. So, there are a lot of areas of potential interest in research. Most of us that are in this field feel like, we should be prescribing that for patients. And I'm happily able to do that. I'm going to probably bring in some vibrators into my office this year for that purpose. But anyway, please enjoy this episode. Enjoy learning from another person's journey and enjoy learning about how to make your own vibrators. Hey y'all, it's me, Dr. Smina Rahman, Gyno Girl. Welcome to another episode of Gyno Girl Presents Sex, Drugs, and Hormones. Today I have a very special guest that you guys are going to enjoy hearing about and all the great work that she's doing in her advocacy for women, as you heard in my intro. But I have Lara Pack, and she has agreed to come on to the podcast and share her stories and why she's doing what she's doing. So, I'm excited for you guys to hear that. Let's get into it. Let's talk with Lara today. Lara, thank you so much for joining me all the way from Australia, right?
Indeed. Thank you so much for having me. Really appreciate it.
I'm so excited. Lara and I met probably like 2 years ago. Was it menopause or was it at ISWISH? It was at one of the
Both,
conferences.
but yeah.
Oh, yeah, and we're going to talk about the amazing work she's doing in advocacy and her side gig on vibrators. But we're also vaginismus sisters. So
Well,
we're just saying the pain brings us together. But
yeah.
I think that I love to for when people tell their journeys, because I feel like people can learn so much from just how the struggles of others and how they were to overcome their situations, and what they utilize. And those of us in these forums of educating are really here to make sure that people don't make the same mistakes we did, right?
Yeah, exactly. If we can.
Uh, if they can, yeah. So yeah, Laura, tell the listeners a little bit about who you are. I mean, they already heard your intro, but and what brought you into the sexual medicine world.
Yeah. Okay, cool. Well, I'm Lara. I'm a mum of two daughters, now 12 and 8. But I came into this. So I had vaginismus, as you alluded to, and we spoke about before. It was kind of post kids, where
Yeah.
all of a sudden it felt extremely painful, like knives stabbing me. Went back actually to the obstetrician who delivered my kids, and um, he tried a few things, but was like, I think you just need to go see a pelvic floor physio. One of the things I really struggle with in this area is that it's so complex. So it's
Mm.
psychological, it's physical, it's emotional. It's hard to cure, which means
Yeah.
it's hard for a lot of healthcare professionals to deal with it because A, they've got to spend the time to get to know what's going on, and then B, it's a long process. But went to a great
It's the
pelvic floor physio.
biopsychosocial we talk to about, we always talk
Yes,
about biopsychosocial because that's what sexual function is. It really is a function of your own health, but also like, that's how we have to address it through all the parameters.
exactly. So I went to pelvic floor physio and we did some work. We used dilators. I hate dilators. I get why they're important. I understand it. I just think, it's like, hey, take this plastic looking phallic thing, put it in you and then relax.
Yeah. Yeah.
I'm like,
I get
okay,
it.
well, that's an interesting concept. But anyway, she
That's what's interesting about dilators is that we really, have very little standard on how you should use them. Like, what's the best way? Like, I mean, we have some studies that are there, but like, I think every PT has their own sort of like recommendations and their own sort of way of really discussing this with them. Like, you leave it in this amount of time, and then you're going to go up to this one. And then,
exactly.
because when we talk about vaginismus, again, just for the listeners who are listening for the first time, it's involuntary contraction of your pelvic floor muscle, which sometimes can be primary, where people are never able to have anything in their vagina, and sometimes can be secondary to something else. So I'm interested to hear a little more about the story because usually if you've had a traumatic birth injury or, you know, you suffered from, or if you're lactating, you develop sort of a genital urinary syndrome of lactation, which I've talked about the genital urinary syndrome, menopause, and hormone deficiency. And so, was all of this vaginismus sort of secondary to the lack of vaginal estrogen if you were lactating? And then, how are the muscles treated? Like, how are the dilators used? You know, what kind of, there's, I think, some paradigms on using dilators plus, trigger point injections or baclofen Valium or, also, vaginal Botox. So there's a lot that can be done, but it's really, we always call ourselves sex detectives because you got to get to the bottom and you want
Yes.
to get to the root cause of what the pain generator is. So tell us a little bit more, Laura. Like, did somebody do that for you? Like, get to your root
Oh my
cause?
gosh, no, you're talking and I'm like, "Oh." No one went into any of this kind of detail. They're just like, "Oh, you've got a problem. We
Oh my
may
God,
or
you
may
should
not be
come.
able to fix the problem."
Right. Mm.
But it's true, and
That's
I think, I mean,
unfortunately the majority of patients who suffer go to clinicians who feel that way, it's like they don't know the difference.
absolutely. And I think, it's interesting, right? I don't necessarily come from a medical background. So I don't understand the exact details of what you're saying, but I think of it on a human level where you've got this sexual organ that then all of a sudden becomes very clinical. And one of the things that did happen in my pregnancy, I had hyperemesis and then I had so it was diagnosed as irritable uterus. I remember arguing with the doctor, I'm like, what uterus is not irritable with, that much weight in it?
That's a new one, okay.
So, I was in hospital a
Oh, your
lot.
uterus is just irritable, hon.
Yeah,
It's
your
okay.
uterus is just
Well,
I mean, can you imagine a man? And they'd be like, "Oh, yeah,
penis is irritable, dude.
your penis is irritable." Um,
Yeah.
but I was in hospital a lot and had a lot of exams, and I do
Mm.
think that's part of what contributed because this sexual organ all of a sudden became very clinical, all of a sudden had a
You never
complete
had sexual
different
pain in the
makeover.
past.
Sorry?
You never had sexual pain before this.
No, didn't have sexual pain before. So it kind of started at this point, and I think there's something in now I also have a longer history of I had endometriosis. I had
Good,
it
yeah.
removed when I was 15. I had
Okay,
surgery, and then I
okay.
had a blood drain put in and was in agony, and when I went back to the doctor 10 days later, was still in pain, he said, "I think you're imagining your pain, go see a pain clinic." And that was when I was 16 years old.
Oh god, of course, it's all in your head,
Yeah.
Laura.
All in your head.
Yeah.
So I think all
Well,
these things kind of combine.
right. Well, we know with endometriosis, there's a lot of factors with, not only like inflammation and where the implants are, but also the fact that when women are in pain from endometriosis, they're likely, clenching their pelvic floor a lot. And with that pain and that clenching, your pelvic floor can become very hypertonic. And then if you throw in a little bit of anxiety or depression symptoms that come about when people experience too much pain, this is not unlike, what a lot of my patients experience. And actually, just as a side for you, like there's a lot of data to suggest how there's an association with like endometriosis and inflammation and nerve, potentially like increased nerve endings at the vulvar vestibule, and whether or not these nerve endings then create mast cells, which then proliferate, causing, it's a combination of nerve endings and mast cells that happen at the opening, which some people get sort of an acquired nerve pain at the vestibule that then lead to a secondary vaginismus. So there's a lot, that might have been contributing to what you experienced.
Yeah,
And
absolutely.
so I'm curious to know, like, how that evolved for you because, like after the endometriosis surgery, were you kind of pain free? And did you have the surgery because you were in pain? See, now I'm getting my sex detective hat on for
No, 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 get your sex detective hat on. So, was still in agony. I ended up just going on the pill and not having any periods, but was still in a lot of
Mm.
pain. Ended up having a repeat laparoscopy, and what they found was tiny amounts of endometriosis, but actually huge amounts of scar tissue. So, I'm
Oh,
type
wow.
1 diabetic. I don't heal brilliantly. And what they were saying
Well,
is that
that's another sign.
actually, in some ways, the
Mhm.
surgery itself left this lasting damage. So, I ultimately have ended up in a situation where I was on the pill until I decided to get pregnant, and then went on an IUD straight after because I genuinely cannot handle the pain of periods,
Oh, I'm so
um, and the irregularness of them. So
sorry.
I
And endometriosis is truly a full body disease. Like, we talk about it just being in the pelvis, but, people have what we call catamenial signs or signs during their menstrual cycle where they'll get shortness of breath or chest pain or palpitations or, bowel dysfunction. And, and those, are more advanced cases of endometriosis, but really secondary to some of the inflammatory factors we think are associated with endometriosis, which
yeah,
affects 1 out of 10 women. So it's not like, I bet it's more
exactly.
than that. I bet it's
I
more than
think it's
that, Vince.
definitely more than that. I reckon that would be just the ones that actually get tested
Informed.
ultimately. But I've been helping a girl who messaged me. She's 16 now, and she was in so much pain and being dismissed. And she sent me a text
Mm,
through a family friend and said, "What should I do?" I said, "Go see this doctor. He was excellent." And she
mhm,
started on some drugs which didn't work for her, and she's actually about to have surgery. And she's
mm,
going through this whole process, and it's just, I mean, she's lucky that I knew her and knew where to send her to, but generally what happens is you go through specialist after specialist after specialist. You go to GPs that don't know.
yeah.
They say, "Go get an ultrasound," and then if there's nothing on the ultrasound, "Oh, you don't have anything," but
You don't
that's
have anything.
ridiculous. It most of the
Right.
time doesn't come up on an ultrasound,
Yeah,
so
exactly,
yeah.
exactly. Where, unfortunately, our diagnosis is, a lot of us go by clinical symptoms and assume that this is endometriosis and try to treat it as such. But obviously, like the traditional gold standard is to have a laparoscopy to assess and then remove tissue and then send it to the
Exactly.
pathologist and see what happens. So,
Yeah, exactly.
well, you went through all
Um,
that. You had your baby, little complications around hyperemesis, right?
yeah, so I had
Pretty
hyperemesis.
significant. Hyperemesis when you have to get hospitalized, that's significant, actually.
Yeah, it was pretty horrific, not to be confused with morning sickness.
Right,
But
right.
yeah, it was pretty horrific. So I went through this whole process. So afterwards went to the doctor, so back to the pelvic floor. She suggested using external stimulation with vibrators. And for me, that really helped. And I think
Mm,
at its core level, before we get into any kind of details, is that you're stimulating the nerves in the area you're getting blood flow.
yeah,
And for me, that was enough for the muscles to relax. And I always liken it to if you've got sore shoulders, you go get a massage and someone's kind of putting blood flow back into the area, or you put
yeah,
heat on it to try and attract blood flow.
mm,
It's the same all over our body. It's just for some reason we tend to neglect any of these areas and not use it. So for me, that worked. It doesn't necessarily work for anyone. And I'll put that disclaimer there. I'm not
yeah,
here to say there's this
yeah,
magic cure, but it
mhm.
helped to use pre-penetration and during penetration. And so for whatever reason, it helped the muscles for me relax. But
So you
I
would
kind of
use a vibrator before having penetration, either with the dilators or with, when you're having
yes,
intercourse, and then
yeah,
you used it after to kind of like, maybe even massage or decrease the well, you're also, like you said, you're increasing the blood flow, you're doing all the things that, we hope that
yeah.
will help and cause some pleasure at the same time.
Exactly. So the pleasure was a great side benefit of it. Um, so I started looking into it, and I actually decided I wanted to make my own because I looked at the companies, and there were a couple of great ones, but um for anyone who doesn't know, there's literally no regulation around pleasure products. They're considered novelty.
Yep.
So you can make anything you want, you can package it up, and I was just unbelievably confronted by that. And I wanted to make my own products that I knew I could trust, but also a brand that I felt I could own. And really, what I want to do is bring together the education side and the products, because products alone don't work.
Mhm.
For some people, they may, but really, what you need to understand is what's going on in your body at the same time, which is why I want to work with people like you that provide that, right?
Right.
This is multidisciplinary and multifactional. And so
Absolutely.
we've really got to look at
Absolutely.
all of it.
Yeah.
Um, so the reason it's still my side gig is because I refuse to take on any investors, because I don't want anyone to have a say. I don't want anyone sitting and breathing down my neck and saying, your sales aren't high enough, you've got to do this, you've got to do that. I want to
Right.
keep the quality and ethics with the company. And if that means it's never a multi-million dollar, billion-dollar company, that's okay. But if it
Sure.
helps the people that buy the products in the meantime, that's the goal.
So
Um,
so how long did it take you to become sort of like pain free? I'm assuming you're pain free. Fingers
I am
crossed.
pain free. It took about a
Yeah.
year of regular visits to pelvic floor, of lots of practice at home. And the reason for me was that a lot of it was psychological and anticipation. And I find it's
Mhm.
interesting because I actually got a message the other day that I need to go get my pap smear, and I'm
Mhm.
anxious already. I'm
Mhm.
already
Oh, boy.
feeling that like
Yeah.
anxiety, because for me that's
Sure.
completely clinical. So what I
Sure.
had to separate was clinical, not as fun,
Yeah.
but pleasure or penetration, different, even though
Yeah.
same concept. And I say, context matters. If I
Yeah.
say to you, hey, can you lie down? I'm going to take this metal device or plastic device. I'm going to spread your vulva, vagina open. I'm going to insert something in you. You instantly going to clench. It sounds horrible. But if I say,
Mhm.
hey, I'm going to go down and I'm going to start massaging around your clitoris, and then I'm going to use my fingers and gently open up the opening and then put a vibrator or something. That could be good. And
Yeah.
they're
Yeah.
technically the same things happening, but the context of them and the way they're done is very different. And so I
Mhm.
think that's really important to consider. So it took about a year, and I started developing these products. My first one was a disaster, which was great. I think it's
Yeah.
always good to have a failure,
Learning.
because
Yeah.
you realize, yeah. So I made a heart-shaped vibrator that you could wear in your panties or around your neck, and I thought it'd be fun to have this, like, no one knows it's a vibrator. Um,
Li
I flew over to China. I got on a train with a guy that I'd never met before and went to their factory, and I had a wonderful time, but realized, when I met the quality team afterwards, that was my issue, right? I needed the quality team up front, not after.
Yeah.
So I
Yeah.
ended up scrapping it and starting again. And then eventually decided that actually it was the material that mattered to me. So I found a new factory to work with that uses specific type of liquid silicon, where the products are quite creamy texture. So
Mhm.
normally with products, what you do is you take plastic, and you can do any shape, and then you
Mhm.
just cover it in a layer of silicon. But I find that very hard. And
Mhm.
for me, and I don't necessarily speak for all women, but it's a very soft tissue area. And the
Mhm.
idea of something hard and phallic was just not what my body wanted or needed. So I
Mhm.
wanted to create products that actually could bend and flex and move and were soft, but still had the rigidity to hold their shape,
Mhm.
and also that we're non-phallic, because when you start doing the research, as 25% of women have experienced sexual trauma. And that's often what leads to the pain. So the last thing you want to do is say, here, take this phallic looking device and try and create pleasure, when actually that's what caused you trauma in the first place. So,
Yeah.
really trying to move away from some of these things that are happening and understand what are some of the reasons people are experiencing pain.
Yeah, no, that's very interesting. And so you came and then so I mean, how did you go about, like, even figuring out what kind of design you wanted? Like,
Yeah.
what was the final impetus that was like, "Hey, this is something I need to do?" Like, why did you what pushed you into that? Was it because of your just general,
Yeah.
like unsatisfactory time that you had with what was available?
It was, and it was knowing that if I did it myself, I'd be able to have the ethics behind it. And,
Mhm.
I still love people send me emails all the time to say, I can't tell you how much this has changed my life. And thank you. And husbands emailing saying, my wife's really experiencing pain. What would you recommend? And we go through, which product to choose,
Yeah.
and how to choose. And for me, there's just nothing in the world that is better than that. So I do anything to be able to offer that to women. And I also, the secondary part of that is going back to having two daughters. There's
Uh-huh.
so much stigma. And it's
Mm.
interesting because I've copped a lot of it, as I'm sure you have been in this world, where people are like,
Mhm.
you're going to traumatize your kids and how can you do it? And why do you want to talk about vibrators and all these things? And I'm like, well, because I want my children to grow up in a better world than I do. I want them to be able to walk into the gas station and the pharmacies and things, and their pleasure be as important as the 3,000 ribbed condoms that are there for the guys and the Playboy magazines that are readily available, but then you can't talk about women's sexual pleasure anywhere and you get banned on Instagram if you have a conversation or anything. So whether we like it or not, we still live in a very inequitable world. And I want to be part of the change that moves us
Absolutely.
into next generation.
Absolutely. So you obviously did a lot of research trying to get this going. Tell us a little bit about your products then. Well, your company's called Elixir Play, which obviously
Yeah.
the introduction people heard, but just to remind, why did you come up with that type? What did that type
Um,
or the
Yeah, so
name?
it was interesting, right? I get asked that a lot. So, the word elixir actually means a magic potion or spell. And for anyone who's experiencing pain, I remember literally sitting in the doctor's office and saying, but isn't there just some tablet I can take, something that's going to fix this? And
Yeah.
of course, there isn't. So I was like,
Mhm.
okay, well, it's a magic potion or spell, but then play because as we get older, we forget that sex is supposed to be playful.
Well,
If you think to
yeah.
your teens and your early 20s and like it was fun and it was enjoyable. And actually, part of the solution to having great sex again is to just let go and be playful and
Yeah.
forget, forget the tiger marks, stretch marks that we've got all over ourselves and forget how we
Yeah.
look at all these things and just be proud and love our bodies and have a bit of fun. And it's not
Yes.
supposed to be serious. It's not supposed to be scheduled into the diary at 9:05 p.m. for 5 minutes or 10 minutes or whatever. So those two things for me, again, trying to be holistic is about let's make it fun and let's work with all the different tools that we have available to try to help women have a better sex life.
Yeah. That's wonderful. And so you have a couple of well, tell us about what kind of type of products you have. I actually have yours in my
I've got them
studio
here
here.
so I can show
Oh,
you.
good. Okay.
Oh,
Good,
good.
'cause I was like, I
Um,
forgot to bring mine because
it's okay.
I
So I
was
have
running.
3 at the moment and 1 that's about to come out. So the first one here is amethyst. So this one's more the traditional rabbit. So you said about design. I think rabbits have a place, from the perspective that, they cover both internal and external. Literally after having kids, I was talking to that same doctor and I said to him, hey, just out of interest, is a penis designed for pleasure? Like, is the shape designed for pleasure? And he was like, well, actually, it doesn't really matter. It's a muscle. So it doesn't make a difference. You probably wouldn't want something harsh and square. So that was fair. But like, if you look at this here, it's kind of got these flat surfaces. And for me,
Mhm,
that's kind of an ode to our bodies are all different shapes and sizes. And so,
mhm.
what you want to do when you're using these products is be able to cover as much surface area as possible. Very
Mhm,
unsexy, but cover as much surface area so that, for different women using it, you can feel the pleasure in different places. So, you're
mhm.
kind of getting more opportunity for it to make contact with your skin and tissue and nerve endings. And then on the outside, kind of the same thing, right? We talk a lot about glans clitoris, which is right up the top. But for a lot of women, think about a wishbone, they're feeling their pleasure down the sides.
Yeah,
And so
yeah.
you want to be able to kind of cover that and then this move independently. So
Mhm.
essentially they can work together. And then I have a lot of women that actually use it externally and just turn it round and use this part here. And it's quite
Yeah.
comfortable to hold. So you can go either way. I'm going to turn it on because I think that was the other thing that was really important to me is that I wanted them to be soft. So
Mhm.
this is on now. Not sure if you can hear it. And then if we go up to maximum,
Okay, yeah.
that's it there.
Mhm.
So again, I wanted it to, not have to interrupt your kids, not have to sound like I call it a lawnmower in the bedroom. Um,
What's
these things are
mom
very
doing tonight?
unsexy.
Where's mama? She's doing
That makes
something.
sense. No, exactly. Why is that
Yeah,
buzzy noise? So that one's amethyst. And then this one here is ruby. Now,
yeah,
ruby was kind of based on a shoehorn. Um, so again,
yeah,
this was like that ode to products that don't necessarily look like vibrators. So this is a nice intro one. The
yeah.
bulb here can be either for internal or external pleasure. So either
Okay.
works. But
Yeah.
the reason it's got the grooves is that your fingers can kind of sit there and then guide for massage.
Oh,
So
nice.
I'm a
Okay.
big believer in being able to use massage and exploring because the thing is, if you know what feels good for you, you
Yeah.
can tell someone else or you can keep doing it for yourself, but you've
Yeah.
really got to start with you. And so the
Mhm.
best way to do that is massage. And I'll show you here the creaminess. It just kind of glides against the skin. So I didn't
Yeah.
want it. There's a lot of products out there that kind of, you'll be pushing it through and it's like that old soap bar where you're like
Yeah.
grinding it against your skin. You want it to
Yeah.
move really gently. And then the last one's garnet. So garnet can be used as a cock ring. So this does have a lot of stretch to it,
Yeah.
but it's designed to be shaped like a vulva. So
Okay.
the idea is, and it's got some grooves on it that
Mhm.
kind of are opposite on different sides. So you can kind of put it wherever it feels good. And then you can also use it as a handheld. So you could hold it like that,
Yeah.
or you can literally just hold it in the palm of your hand. So
Yeah.
really nice external pretty, but also functional toy. And again, keeping in mind, trying as best as possible to keep in mind what shapes we're looking for, and
Mhm.
also the opportunity for it to be able to cover as much area as possible.
Yeah, wonderful. I love those. And so when we post it on YouTube, people will be able to actually see it. Otherwise, you'll just have to pay attention to the description.
Yeah.
Um, or you go to your website, which is
Yes.
what?
So the website's just www.elixirplay.com. So you can get that
Yeah,
afterwards.
and
But
it'll
yeah,
be in
go
the
to the
show
website.
notes. Yeah.
Yeah.
Yeah, it'll be all in the show notes. So how did you end up like coming to Ishwish and like, getting involved in the sexual medicine community?
Yeah. So going back to holistic, my dream, my goal is that this is available when you go see your healthcare professional.
Yeah.
I think there's a lot of
Yeah, we
synergy
talked about it.
between what we do. So I wanted
It
to
should be a
go,
prescription.
yeah, exactly. It should be a
Yeah.
prescription. It absolutely
Yeah.
should.
Yeah.
But I went because, well, two reasons. One was to connect with healthcare professionals. The other is the only way that you guys get the opportunity to continue to develop and grow is if we support you and
Mhm.
contribute to your education and learning. So, if none of the companies are willing to actually sponsor healthcare professional education, you don't have as many resources to be able to offer your patients. And so
Yeah.
it's got to start somewhere. So I think the synergy works there. I also went for my own learning. It was incredible. I learned
So
so
great.
much.
Yeah.
Iswish was outstanding. I'm
Yeah.
very, very much looking forward to coming again either next year, if I can, if not the year after. But
I appreciate it.
I think it's really important. It's really
Yeah.
important to connect. And, um, people spend lots of money putting them in sex toy shops and things and adult shops, and that's great.
Mhm.
For me, that's just not the place because I want someone who can have a conversation at the same time and
Yeah.
show you how it's going to work and show you how, based on what your needs are, how it can
Mhm.
complement. And so that's a very individual conversation that I believe comes from a healthcare professional.
Wonderful. No, I totally agree with you, and I think we both talked about, we should be stocking this in our office and giving it as a prescription and all the things, which I'm planning on working with you as with, so people have some accessibility for different types of vibrators, which we know, like studies have shown, really can help, improve pelvic floor outcomes. Also, like there was someone that presented an abstract, I want to say last year at Ishwish on, how to decrease pain and IUD insertions.
Yep.
And it was Nisha McKenzie, actually. She's out of Michigan. And basically, she had her patients bring in their own vibrator, or she used, a clinical vibrator and had them put it at their belly button at the time of
Yeah.
insertion. And so it does twofold. One, it distracted them, obviously, like, because they're thinking about, and other thing is like, for those of you who've listened to my other podcasts on vestibular dynia, the belly button is, um, a primitive part that was of the urachus, which is very much the same tissue as the opening of the vagina or the vestibule. So a lot of people can get double, potentially not only distracting them, but make it more, make it feel better, and therefore they had less pain during the time of their IUD insertions. That's what her abstract showed.
Yep,
So I
that's
think
amazing.
vibration is so important. Vibrators, vibration therapy, all that is very important. And I think it should and will be eventually part of standard of care when it comes to a lot of these pelvic floor and sexual dysfunctions.
Yeah, I look
So
forward
I
to
think
that
what you're
day.
doing is, yes. Tell us what else is on the horizon.
Yeah, so I've got a new product coming out. We've just finished production, so it should be out hopefully the end of this year or early next year.
Oh,
It's kind of a thinner um, internal external vibrator. So I'm kind of bucking the trend. Everyone's going bigger, I'm going smaller. It's just a good intro toy and still got great vibration for external and internal, but a nice kind of starting. And then looking at a long pipeline of different things that we can do. So, been over to the factory in August and trying to get an understanding of what people are looking for, what's missing. It's hard because a lot of people want internal and external at the same time, which
yeah,
outside of doing the traditional rabbits, a little challenging to do. But
yeah.
we're just looking at some innovative ways. And, I love the team that I work with at the factory, and most of them are women, which is amazing. It makes a massive difference.
Oh, wow. That's
So
great.
that's great. And then, yeah, kind of trying to create this feedback system, right? Where healthcare professionals are telling me this is what people are looking for. And people are messaging me and emailing me and saying, hey, can you do something like this? But then also
Yeah.
going all the way down to what's capable at the factory and if they've got suggestions based on what we're looking for and trying to understand anatomy a bit more and how we can, are we doing designs just because we've always done them? Or is there
Mhm.
something different that we could do? So trying to
Wonderful.
keep all of that in mind.
Oh, well, that's amazing. And I always ask, my guests, like, what is your message to women who are trying to navigate? I know obviously you're an Australian-based healthcare system, so it might be a little
Yeah.
different navigating because it's socialized medicine there, right? But
Yeah.
you know, what kind of advice do you give other women about how to navigate this journey around sexual pain or these issues that are so highly stigmatized that, they're, like how did you come to your what advice would you give, I guess?
Yeah. I mean, I think there's a few things. I think one of them is always be your own advocate. We know our own bodies
Yeah.
and you got to keep going and you got to keep going until you find the right people. Now, I'd argue in the US it's somewhat easier because on ISWISH you can actually find medical practitioners, which is much
Mhm.
easier. In
Mhm.
Australia, that doesn't exist as much. But I think don't let doctors or healthcare professionals or people ghost you and
Mhm.
don't let them make you feel like you're the one that's insane, because I think it's really important. I think the other thing that's really important is talk about it. It's the same
Yep.
thing as miscarriage. For some reason, we don't even tell anyone we're pregnant until 12 weeks in case we have a miscarriage. It's
Mm.
ridiculous. Like,
Yeah.
why would we not talk about it? Why would we not share the experience? I know for me, when I had a miscarriage, I wanted to find out that other people were in the same situation because it gave me hope that maybe I'd be able to have a baby one day. So I think
Mhm.
the same thing happens with pelvic pain and sex. And the other thing is be hopeful and try different things. It's very, very, very much a multifaceted approach. So I think
Mhm.
finding the right healthcare team, finding the right products, finding the right solution that works for you, finding the right mindset, unfollow all the people on Instagram that are bringing down your day and start following the body positive and healthcare professionals that are teaching you and helping you learn to love your body again because we're
Yeah.
constantly in the society where we're brought down. But
Yeah.
there's a little path to navigate through that I think are really important.
Absolutely. Absolutely. Well, that's wonderful, Laura. I appreciate you so much telling your story and what brought you into the journey of, the side gig that you are doing, which I hope is continues to be very successful for you. You're helping so many women, and you're just such a kind person. So I enjoyed meeting you in person when you came to Chicago last month.
Yeah, I loved meeting you. Yeah, last month. Thank you. And thank you for all you do as well. I don't know, people probably take it for granted listening to your podcast, but you truly are amazing, and the advocacy and education that you give people is just out of this world. So
Oh,
it's
thank you so
amazing.
much. Thank you. Well, you guys are gonna hear everything's gonna be listed on the show notes and where you can contact Laura, where you can get the products, and whatever else she tells us to put in there, we will put in there. Laura. So, thank you guys for joining me today. Remember, I'm Dr. Smina Rahman, Gyno Girl. I'm here to educate so you can advocate for yourself. Please, have a good day and join me for my next second. Please subscribe to this podcast. I'd love for you to be a follower and learn as much as you can about the things that we're going to talk about with all the people on our journey. Please review us on Apple or Spotify or wherever you listen to podcasts. These reviews really help. Review us, comment, tell me what else you want to hear to get more information. My practice website is www.cgcchicago.com. My website for Gyno Girl is www.gynogirltv.com. My Instagram is Gyno Girl, so please follow me for some good content. Additionally, I have a YouTube channel, Gyno Girl TV, where I love to talk about all these things on YouTube. And please subscribe to my newsletter, Gyno Girl News, which will be available on my website. I will see you next time.